we'll get started here. If anybody comes in the middle of it, they can just quickly find a seat. And I'm going to turn this guy on. Oh, come on. Okay. So here tonight we're going to be talking about managing yourself and your recovery. And first we have a bit of housekeeping that we normally do. Introductions. I am Deb Angus. I'm the founder of this group. I'm a traumatic brain injury survivor warrior and also an author, speaker, and advocate. And I wrote and researched this book over a 10-year period. And it's been described by a professor in family medicine as actually it's better than a PhD thesis, he said. So I'm quite proud of that work there, and it is available at the Calgary Public Library on loan, and it's available here at our meetings as well too. And I used to work at the university as a research assistant, so that's how I knew to get around all this stuff. And the other helper here I have is Josie, and she helped me get started in 2016, and she's now 3 years post-injury and still having difficulties in learning to live with this injury. So she was hoping to make it tonight, but I'm not sure if she can or not. And she still advises me in the background of what she's putting up with and how her family's dealing with this and that type of thing. Why are we here? We started up this group, and we're here to help raise awareness about the seriousness of concussions and traumatic brain injuries, to help you understand the symptoms of a concussion, how easily these injuries happen, the healing process for concussions and brain injuries, and to share coping strategies to help you better understand this injury and help you live well while recovering, to help you recognize that multiple concussions can lead to serious consequences that can impact your career, your relationships, and your future health. And we have medical disclaimers here. The ideas, suggestions, and general principles and conclusions presented are subject to your personal health and sound medical advice. Every possibility is not represented here, nor do we presume that all possibilities relate to your situation. This awareness group is not a substitute for recognized medical advice or treatment. Always consult your healthcare practitioner for medical advice. And we have group guidelines for confidentiality, respect, and participation. Thoughts, feelings, experiences shared in this group will stay in this group. Respect others' right to keep their information private. Accept and respect what is unique to each attendee in the group. Be respectful of other spirituality, religion, and belief systems. Allow others equal time for sharing. Feel free to ask questions at any time during the presentation. And if you prefer to remain silent while we have our sharing circle, and pass on sharing at any time, please feel free to do so. And we have a meeting structure here, 20-minute presentation, a 10-minute break if anybody is fairly high symptomatic and needs one, and we'll have an opportunity to ask you for that. Then we continue with our presentation. Sometimes we bring in guest speakers, and then we follow up with a 30-minute sharing circle. And now is the time, if anybody has a cell phone that hasn't been switched off yet, to please do so. And we start our presentation here for the evening, managing yourself and your recovery. In this session, we'll be discussing the importance of not overloading yourself with too many therapies and too many appointments in your quest for wellness, which will result in worsening of your symptoms, more headaches, more sleep difficulties, increased stress, moodiness, anxiety, and depression. So we want to try and keep those at a low level, and the way you do that is by managing things a little bit better than possibly what you have been doing. Very important to learn how to pace yourself, incorporate strategies of self-care, avoid overstressing and overthinking, and where and when to ask for help. I think we've all been at that point at some time in our recovery. And we always say this in this group, I use this slide quite often, educate yourself and do it now, so you don't end up on the treadmill of too many doctors and too many pills and still no answers. So managing yourself and your recovery, because many of us have discovered there is no centralized care program for concussions here in Alberta, as it is with many provinces across Canada. So important for the general public to educate themselves about concussions, how easily they happen, how uncertain the recovery timeline is for many, that family doctors receive no formal education on how to care for these injuries. This is a highly evolving field of neuroscience. Research and discoveries are ongoing. Concussion care models are shifting. Like in the past, they used to say you need to rest, total quiet for like a month, 2 months, just don't get out of bed and just total rest. Now they're changing that and they're saying rest for only 24 to 48 hours and slowly start incorporating light activities like making a cup of tea or going out walking in the backyard and doing dishes, stuff like that. If that is even too much for you to handle into sequence, I finally got the word. I was going to ask you to remember that word in case I forgot, but I got it. So the concussion care models are shifting. So if you're coming across doctors or practitioners that are saying, well, you should be resting for a month or two, that's old thinking. It's now being updated to saying rest only for the first 24 to 48 hours, and light activity is helpful. Healing modalities are also advancing, and increased awareness is driving most of this change. But the general public is still very frustrated and angry with the agonizingly slow progress, because we're suffering with this day after day after day, and there seems to be no help out there for us. It has been found that knowledge, proactive involvement, self-awareness, self-advocacy are key to quality of life following brain injury. And we're going to be discussing these points here this evening. And this is a model I came up with to help explain to people all the different terminologies you're hearing out there. And concussion is part of the traumatic brain injury. And so tonight we'll be focusing more on concussion recovery. On the far left there, there's concussion, post-concussion syndrome, and persistent post-concussion syndrome. And just a quick note here, because we do cover this more in depth on our other videos. What is a concussion? The first one, you should watch that if you haven't as yet. A lot of people out there, especially even high-end organizations like the Center for Disease Control and Mayo Clinic, they're all out there saying concussion, i.e. also known as mild traumatic brain injury. And this is the hard thing about this evolving science, is nobody's really agreed yet on what the official medical definition is of concussion. They're trying to recognize it is a serious injury, and a lot of people are grasping at the title mild traumatic brain injury. And that's why I drew the line across there, because that's the permanent territory. I myself had 4 concussions. I wasn't aware of the first 3, and I had a neuropsych assessment done at Foothills Hospital at the brain injury clinic there, and I was diagnosed as mild, borderline, moderate. And we have a fellow here this evening, and he was in a serious motorcycle accident 8 years ago, and he was also diagnosed as mild traumatic brain injury. These are permanent injuries, and how can they say that concussion is also known as mild traumatic brain injury, when a concussion, if it's your first one, you should be better after a couple of weeks to maybe a couple of months. And it's definitely on that side of the red line. And this is how we are looking at that. And this is based on the research by the Concussion and Sport Group and their consensus statement in 2012. And on the table, their first consensus statement says the terms concussion and mild traumatic brain injury should not be used interchangeably. So the anatomy of concussion recovery. When you're first injured, of course, all the physical, highly visible injuries will be addressed by first responders and doctors, such things as cuts and stitches, neck injuries, limb injuries like broken bones, chest injuries, and back injuries. Head and neck injuries are quickly assessed for obvious visual injuries. Usually then you're sent for x-rays, CAT scan, or MRI while you're in the emergency department. You will be assessed for possible concussion, but in reality, many symptoms usually do not present themselves until at least 7 to 10 days after an injury, as we discussed in the video, what is a concussion, and the cascade of chemicals that is still ongoing inside your brain after the initial injury. So what they are actually looking for, the most visible signs of concussion, is the dilated pupils. Maybe you're dizzy, or maybe you're throwing up, or maybe you're unconscious and you're not responding properly. Those kinds of things, they can determine if that is a concussion. But you have to be aware, as ourselves in the public, that more symptoms are likely to present themselves 7 to 10 days after that injury. So mostly you will be told to go home and rest for a few days and it will get better. I hear a lot of people, this is what they're being told. But when and if it doesn't clear up or get better, you should then follow up with your family doctor. I've talked to so many people that they never did. they just said, okay, well, 2 or 3 months went by, I'm still not better. I guess this is just the way it is, and nobody's going to help me, and I don't know what to do, so I just have to learn to live with it. No, it's your responsibility. After, I'd say, 2 to 3 weeks, if your symptoms still haven't cleared up, go to your family doctor and report all your current symptoms. This has to be documented on your medical file. After 3 months post-injury, if still experiencing symptoms, then go back again to your family doctor. And here in Calgary, you can get referred to the CAR program, which is the Calgary Accessible Rehab Program, or the Brain Injury Clinic at Foothills Hospital. And they do have waiting list for the clinic, the Brain Injury Clinic at Foothills. I'm not aware of what it is right now, but I know in the CAR program you have to be 3 months post-injury before you are referred for that program, because the thinking is most concussions will clear up before that amount of time has passed.
They're also saying that they're not going to accept anyone but sports.
Yeah, I haven't looked into that yet. Remember you said that last month, and I want to call up somebody and see what's going on with the CAR program. I've talked to a couple other people, and they said they can't imagine that, because that's what is our thinking, is that's what it's there for the general public. Not just for sports-related injuries. I know.
It'd be terrible if they do.
Oh, no, I have to look into that. During the months before starting a formal rehab program, you can still be proactive, and you can still manage your own care. You don't have to sit back and say, well, the doctor just told me to rest, so that's all I'm going to do. Well, you have to take responsibility. If we had a proper system set up here, ideally we would be assigned a caseworker who would say, okay, do this next, do that next, and we have to do this and do that. It's not set up that way here. Hopefully someday it will, but right now it's your job to do what is necessary to keep yourself going while you're waiting to get into any of these rehab programs. So you have to keep as active as possible. Like we said earlier, just start doing stuff around the house and see how that goes. Start going for walks. If you're not feeling safe to be outside by yourself, have somebody with you. If you have balance issues or vision issues, you should have somebody with you just to make sure you are safe. But it is important to keep as active as possible. Educate yourself about concussion symptoms and possible therapies. Review your concussion or accident history with family and friends. Like I said, I had 3 prior concussions throughout my lifetime. Knocked out cold in all 3 of them, ages 8, 17, and 22. Hadn't a clue that those were concussions. Nobody talked about that kind of stuff back in the 60s and 70s. So now the 4th one came along, and I can't figure out why I'm not getting better and why I've never been the same. And so I started doing some digging and found out that, oh, I had these other 3 prior concussions. No wonder. This 4th one's hitting me the way it is. And this is the cumulative effect of concussions, which we also talk in our video series under effects of multiple concussions. So keep your family doctor updated on any changes to symptoms or any new symptoms that may appear. It's very important. I cannot stress this enough to have this documented medically on your medical file with your family doctor. Oh, sorry. This thing's a little slow for me sometimes. Any sudden onset of new symptoms, such as intense head pain, significant speech impairment, visual or mobility issues, go to emergency immediately. Don't fart around with this. Don't wait for your family doctor. Don't go into a walk-in clinic. Go to emergency. Because they can do a CAT scan right away and determine what's going on, make sure there's no brain bleeds or anything more serious going on inside. Be aware of relapse possibilities that can happen when you are under intense stress. Relapse means that you've probably progressed a certain amount in your recovery and you figure, okay, I'm up here, I'm not back here anymore where it was so difficult, I progressed a little bit. But when you're under intense stress, your brain can't handle it the way it used to in the past, and you will have all your symptoms come up full-blown again. So you have to be aware that that will happen, and you don't have to freak out and say, oh, something's wrong here, I gotta go to emergency. It's a very hard distinction, but once you've had a few relapses, unfortunately it does happen. I've had several of them over the last 17 years. I've lost count. So when you're under intense stress, prolonged mental or physical exertion, like when you're packing and moving and stuff like that, it can all come back up again. Prolonged or ongoing sleep issues, and when you're not pacing yourself. So this is where we're going to be discussing how to control those a little bit better in your life so you don't have these relapses. It's also advisable too to start a medical journal to keep track of all doctors and practitioners you are working with. Start a headache or head pain chart. All these were discussed in our coping strategies video, so you'll have examples on there. You can follow those charts, or you can find them online as well too. Start a sleep journal and work on improving your sleep hygiene. Begin a daily self-care routine. I don't care if it's for 10 minutes or 15 minutes or for an hour, do something and get into a routine of doing that every day. Clean up your diet, so stay away from junk foods, fried foods. You want good nutritional food because you want to feed your brain while it's also healing. Eliminate recreational drugs and alcohol consumption completely while your brain is healing. It's the smartest thing you can do, and you can make great strides in your progress. And join a local concussion support group, or there's many Facebook concussion groups as well there. It's good to join those, and you can hear what other people are dealing with and how they cope with it, and you know you're not alone. It is also important to know that sometimes symptoms associated with concussion can also result from structural issues. So neck misalignments often result in headaches and head pain, dizziness, fatigue, visual disturbances, ringing in ears, which is also known as tinnitus, and also jaw issues, TMJ. So if you suspect any of those neck issues are happening, these are some options here that you can seek help from. Physiotherapy, vestibular therapy, which is a specialized version of physiotherapy, therapeutic massage, holistic or functional neurology chiropractor, not a regular old-fashioned chiropractor that twists and cracks and all that kind of stuff. You want people who are gentle. I'm seeing a fellow, he calls himself a kinesiologist, but he's a chiropractor, and he does energy work on the meridians and that type of thing. There's no twisting and cracking and nothing like that. But he does amazing work. I've been seeing him for a couple of years, only when I have falls and I need help. And also craniosacral therapy, which is a type of osteopathy, is very helpful as well too. And if you wish to check out any of these types of therapies, you will, most of them I think you will need a referral from your family doctor, and this should be covered under your extended health care, or possibly, depending on your employer, you might have a personal health spending account that will be covered in there too, and this is through your employer if you're still working. And even if you're on sick leave, you should still have access to your extended health care. And if this is a work-related injury, it has to go through WCB. You have no choice. It has to go through them, and they have to approve it. Vision issues can also be related to concussion. Things like blurred vision, double vision, depth of field issues, reading problems, sensitivity to light, which is also known as photophobia, sensitivity to fast-moving objects, flickering effects, flashing lights, fatigue, memory issues, poor handwriting, and poor posture. All these are related to vision as a result of your concussion. And if you want to explore those, you have two options here in Calgary. You can seek the help from a neuro-ophthalmologist. They are a surgical intervention. Personally, myself, I would go with the optometrist who has experiences with brain injuries first. They can offer you vision therapy and specialized eyeglasses. Then, if that doesn't help, then you can make the decision if you want to go under the knife or not. But it's a personal decision. And to learn more about vision issues, be sure to view our November 30th, 2017 video, Vision Issues Related to Concussion, and they're both available on Facebook and YouTube. So, is anybody, we're doing okay here? Nobody needs a break? You're okay to continue on? Okay. Am I going too fast, or is good? Okay. So managing your concussion recovery, we're going to be covering points like appointment management, energy management, time management, sleep management, or sleep hygiene is the technical term for it, record keeping, and self-care. So if you were good at managing things when before traumatic brain injury, you're going to become a super manager now. And it's not I like this diagram here, but it's not saying we're multitasking. It's just that you have many tasks and many hats to wear now, because we don't have an assigned caseworker to help us with all this. So now this is your job, to manage everything that's going on to help you recover and to progress in your recovery. So here's a comic I came across, and it's very appropriate for what we're talking about right now. A patient is standing there talking to his doctor, and he said, "So if I need to stop smoking and lose weight, what are you going to do about it?" And I find this kind of humorous. I have come across a lot of patients who have this type of thinking, is that they expect a doctor to hand them a magic pill and make this all go away. Well, especially with concussion, it doesn't happen that way. There is going to be a lot of work involved on your part and a lot of management of different aspects of your healing and recovery that are involved. You can't just sit back and rest and hope it goes away, and it's not going to happen that way. It's going to take considerable effort to make some strides here. And so now we'll start the first section here, appointment management. So these are all the things that will be required to help you with your appointment management skills. The first thing is, of course, you'll have to start making phone calls. And to help you keep track of your appointments, you may wish to write down everything in a daytimer book or appointment scheduling book. Or you may even prefer to keep track of your appointments in a calendaring program, either on your cell phone or on your computer. And I do highly recommend that you color code everything like that, so you can look at it per week and see at a glance everything that's coming up for you, and you pretty well have a good idea of what appointments you're going to be dealing with that week. And I would also highly suggest that you pick up one of those monthly planner calendar boards, like a whiteboard. You can pick up at most office supply stores, and it's just like cardboard that's laminated, and you can tape it to your refrigerator or common area that everybody in the family can see, especially if you're relying on someone to give you rides back and forth to your appointments, so everybody can see at a glance, oh, okay, we got this one coming up next Tuesday, and so they can adjust their plans accordingly as well. So no matter what option you pick to manage your appointments, whether it's a daytimer or scheduling program in your computer or monthly calendar that everybody in the family can see, I highly suggest that you have a backup plan. Basically all three of those options, the hard written copy in the daytimer book, the computer programming program in your cell phone or on your laptop. Make sure you can back up those programs every now and then, the data that's in there, but also the monthly planner. So if one does go missing or one doesn't operate properly or something like that, at least you have a backup plan either in the written form or on the monthly calendar or in the laptop or in the cell phone, and so that you're not lost and not knowing what your appointments are if something happens to one of those options. Always a good idea to have a backup plan. And also to manage your phone calls, I would highly suggest keeping a phone log next to your phone at all times. Just a simple booklet like that with a spiral coil binding, and just loose pages in there, and you can write down notes and keep a phone log. Write down all details. Date, time, name of caller, and subject. You can add appointments to your daytimer or calendars after the phone call is completed. Call at your best time of day for high energy and less symptoms, usually the mornings for most of us. Call in a quiet, undisturbed environment. Speak slowly and clearly. Ask the person on the other end of the line to slow down if you cannot understand them. Advise you have a concussion. Take a small break once the call is completed, and then congratulate yourself on a job well done. Of course, if you find all this too much to handle right now or on any specific day where you're not functioning well, ask for help from a family member to help you make phone calls and schedule appointments. Or if you live alone, ask a friend or a neighbor. Over time, it will become easier for you. It is very important to tackle these tasks when you have the highest energy possible, and very important not to have any background noises or distractions. No TVs, no radios, no barking dogs, no children playing, that type of thing. In a separate room with a closed door would be best for you, so you can have a quiet environment where you can hear the conversation that's on the phone with no distractions. And be patient with yourself. This will get easier for you over time. And don't be afraid to ask for help. And now we move on to our next section, energy management. And here is a graphic here that clearly illustrates the problem that those with concussions and brain injuries have
with managing their energy. And you see in this diagram here, the person on the left who is uninjured, and look at the size of his battery pack here. It says the average person has a battery pack of 15 hours per day. And then look at the other fellow there, the other figure with the band-aid on his head and the tinier battery pack there. It says the person with a brain injury has a battery pack of only 4 hours per day. So it's very important to be aware of that fact, and there's no way you can work around this. This is just the way it is for you right now while your brain is healing and recuperating from the concussion. And it's important to be aware of that limitation and work within your limits for that day. And here is another graphic that helps to explain about reserve energy. The pie diagram on the left there is for a healthy brain, and see how large the portion is there for the reserve energy. There's also cognitive demands, emotional demands, and physical demands. So what happens is when you're operating during the day, when you have any of those demands, say emotional or cognitive or physical, if they overexceed the allocation that they have for that day, they can borrow from the reserve energy to be able to help you manage and get through the day for those demands. On the other hand, with concussion, afterwards our reserve energy has been reduced drastically down to a sliver. So like it said in the other diagram, 14 hours on the left there, only 4 hours over here after a brain injury. And so you have higher demands now for cognitive energy, emotional energy, and physical energy. They are so high right now because you're functioning while your brain is also healing. And so when you overexceed those limitations, you can borrow from the reserve energy allocation there, but look how tiny it is. You don't have much to play around with there. So that's why it's very important to learn how to manage your energy.
So it's also important for family and friends to be aware and honor your limitations. You just don't have the amount of energy you used to have in the past, and you have to recognize you're healing, you're not well, and you need this time to recover. It's also important for family and friends to educate themselves about what a concussion really is. Anytime you hear rude comment from family, friends, or co-workers, it's not an attack on you. It's a clear indication they are not aware of what a concussion really is or the effects of multiple concussions. Kindly send them the link to our videos on Facebook or YouTube and have them start at what is a concussion. Once they educate themselves about what it is you're dealing with, you should not be hearing these rude comments from family like, you're not the same as you used to be. Well, you did this yesterday, why can't you do it today? Well, how come you can't do this anymore? It's because they don't understand what a brain injury is, and they shouldn't be throwing those things at you. So to learn more about managing your energy, we have a video from April 26, Coping Strategies Part 2. There's a lot more information in there about managing your energy. So now we're on to time management. When you're scheduling appointments, I advise never schedule more than one appointment per day.
But of course, sometimes issues happen, exceptions happen to that rule. Like say you do have an appointment to go to in the morning for your concussion, and but also you have a dentist appointment that afternoon. So you do have to sometimes work around these exceptions that you are going to have to do 2 appointments in one day. Just because that's how the schedule is working out. So what I would advise on that is when you see that coming up, you have to prepare for a day or two beforehand, and to not schedule anything at least a day before, so you have time to rest and recuperate and build up your energy, so you will be able to manage those 2 appointments on the next day. And do not schedule anything after those 2 appointments, so you can go home and rest, and if possible even the day after. Keep that clear so you will have time to recover and recuperate and keep your energy levels high, and then you'll be able to have a successful day the day after that.
When investigating various healing modalities, it is best to do only one at a time and see how you progress with that. If you have too many things on the go and you're running yourself ragged and you're not honoring your energy limitations, you're just going to be bringing up all your symptoms that are going to be exacerbated, and you're just going to have such a difficult time. You have to honor the fact that you only have so much energy to deal with, and you're not in a race with anybody or anything. You have to do one thing at a time, so you can manage that and cope a lot better. A reminder, all healing modalities, not all healing modalities work for everyone. You'll hear somebody say, oh, you got to try this, it worked wonders for me, but it might not work for you. Everybody is different, and every practitioner is different. Maybe they had somebody who was really, really good at their job, and unfortunately, not all of them are as good as the other ones are. You must also manage and arrange your medical appointments in conjunction with your regular work schedule and your home life. This seems like an unattainable goal for a lot of people. Your health and healing must take precedence. Obviously, there will be times when family issues are also just as important. Well, I'm sorry. Sometimes it's okay to say no to family and friends. They will truly understand. If they don't, have them watch that video. What is a concussion? And don't forget to schedule in your brain breaks and your wellness time. So now we're on to sleep management and sleep hygiene. Because your energy levels are now so low, it is very important to adhere to a routine sleep schedule. Again, there's no way around this. If you want to make greater strides in your recovery and your wellness, you will adhere to a sleep schedule. If you do not obtain good sleep at night, it will greatly affect your energy levels, your pain levels will go up, and your coping abilities for the next day will greatly suffer. With continued poor sleep, your symptoms will worsen to the point of not being able to cope any longer, and we do not want you there. You want to be at an equilibrium where you can say, okay, this is not perfect, I'm used to functioning way up here, but I'm down here now, but at least I can manage this on a daily basis. And you build from there. And then you have 2 days in a row, and maybe you'll have 3 days in a row, and then eventually you'll have a month, and you go, oh, this is pretty nice, but then you have to be aware that there could be relapses that are out of your control. Maybe a screaming siren goes by, or flashing lights or something happens, and that will push you back. You will have a relapse from certain things, whatever your stressors are, and it's different for everybody, and you have to rebuild back up. But always try and keep that equilibrium. We're trying to stay away from the peaks and valleys. Oh, I was great here, and I was up, and I did, and then the next day you crash. We don't want that. You want you on an equilibrium. So for sleep, it's very important to go to bed at the same time every night, even on weekends and holidays. As boring as that sounds, it really does help for your brain injury recovery. It's also just important to rise or awake at the same time every morning, and it's better yet if you can wake up naturally without a blaring alarm clock. And I did manage to do this. I've been doing it for almost 20 years, and naturally for me, I just follow my natural biorhythm. And when I was working, I had to be at work by 8:30, and I was taking transit, so I had to leave, depending on where we lived, I had to leave at 7:30 to get to work on time. Well, I would just naturally wake up at 5:30. I had plenty of time to do my bath routine, my yoga, my massage, and have a breakfast, and slowly, start out the door and head another day, uncertainty, into the workplace. So it can be done, and it's a matter once you build up your routine. And your brain and your body loves routine. It makes it easier, puts less stress on your body and your brain. And avoid all screens at night. I normally set a limit at 8 p.m. I'm never on any screens after 8 p.m. So set up whatever schedule works best for you, and you say, oh, it's after this amount, so I'm not going on any screens at all. And install blue light filters on all your devices, and avoid caffeine after mid-afternoon. Avoid all alcohol, as it does disrupt sleep patterns. And not only alcohol drinks, but all sources of alcohol, like certain medications, but you need to check with your doctor or pharmacist first to see if there are any alternatives. Vanilla extract actually has alcohol in it, so I'm very sensitive to stuff like that. My brain chemistry is just totally different, so now I can find a vanilla extract that is made out of glycerin, and it doesn't have the alcohol in it. And I can tell the difference. Sometimes I can't get the glycerin. I say, oh, well, I can tell. And same as personal care products. There's alcohol, of course, in mouthwashes, even those hand sanitizing gel, or the foams and all that kind of stuff. Some things you just can't get away from. You do have to use them. The one thing, too, is sometimes you get roll-on. Even if it's made with essential oil, some people use a base of alcohol. and we just can't tolerate that anymore. So try and find ones that are a base of carrier oil, such as almond oil or grapeseed oil, instead of alcohol. All these little things, they do add up. So start a sleep journal to monitor how much sleep you are getting, and note any disturbances that interrupt your sleep, and make adjustments to anything that does impact your sleep. See if you can make some changes so that doesn't bother you anymore. To learn more about improving your sleep hygiene, we did cover that in Coping Strategies Part 2, April 26th video, so have a look at that on Facebook and YouTube. So now we're over to record keeping. Start a medical journal or file for each agency, each doctor, and for each healing modality you are doing. Keep track of names, locations, dates, and any notes of conversations at your appointments, as well as notes about any symptoms or improvements you are experiencing following any treatments. This is so valuable. Say you get down a year down the road and you're still having issues, you can refer back to that and say, well, I did this, and this is what happened. It seemed to work or whatever. Now it's a year later and I'm having problems with this again. So that's something that you can bring to your family doctor or to your rehab program if you're into a formal rehab program and say, well, I have tried this in the past and it did work back then, but I don't understand now why I'm having this issue. So this is good evidence and good documentation for other practitioners for you to have on hand and share with them. It's very helpful to have records of all your appointments and all medical interventions you have embarked on. If you have litigation involved in your case, chances are your lawyer will advise you to keep a medical record. They would need that for their litigation as well too. But it's also good. I found I enjoyed it because I wrote down all the appointments and the names and all that type of thing, but I also wrote down the things that he said and the things that I experienced afterwards and that type of thing. So to me it was more of a healing journal than it was a medical journal, but I referred to it intensely, of course, when I was writing the book, and sometimes I would go back to it and say, oh, look how far I've come in the last 6 months. It doesn't feel like it at the time, but you go back and you go, look at all that I was dealing with. I haven't dealt with that, and that for months. This is amazing. But when you're in the depths of it and living it every day, you don't realize it because it is so overwhelming. There's so much going on. But when you see that written down, you go, oh, I am making progress. Share this information with your family doctor. It's very important to have this documented on your medical file. I think that's the third time I've mentioned that already. It's very important to have this information for if or when you start a formal rehab program. This helps you keep track of your improvements, no matter how slight or unimportant they may seem at the time. Your efforts of being proactive. It shows you are motivated to improve. It shows how important this is to you and that you are advocating for yourself. And it also shows that you mean business and you're not going to take guff off of anybody anymore. You mean business here. And this actually reflects very strongly on you when you go to other doctors and other practitioners, especially if you go into a formal rehab program, and they'll take you more seriously and you go, oh wow, look at all the work you've done and you got it all documented here and you're serious about getting better, and it does make a difference. They will take you more seriously rather than just say, well, I've just been at home resting for the last 6 months.
But that's really like record keeping, maybe not for most people, but for me, that is the worst, absolutely torture that has come out of this concussion. It's almost impossible for me to do this stuff.
Do you have a family member that can help you?
Yeah, I've had my husband, but it's remembering, like, you know, I've set
thing
aside,
in the routine.
I'm going to do this.
Yeah.
And it's totally gone.
Yeah, and this is where a routine comes into play. When you have an appointment and you come home, and if you're not too tired, if you don't need a rest, mark down some quick notes. And then when after you finish having your rest and you review that and you go, oh yeah, and then you write this down into your medical journal and you just say, oh okay, this is what we did and this is what I said, and you'll remember hopefully a little bit more of what, than the key points that you wrote down. It is something that you really have to work at, and like I said, you can't avoid it because it's hard. It's something you do have to keep at and repeat, and eventually, hopefully it will get better for you. And if you find writing, I find writing, and in the research I've done too, writing is very good because it's a physical and a visceral sense. When you're writing something down, you will retain it a lot better than you will just typing it in somewhere. The actual physical sense of writing something down with your brain and your eyes and your hand involved, there's something in there that really helps and train your brain, and it retains the information a lot better. So even just try a little bit when you start. You don't have to get too involved or too much detail, but at least write down the date, the name of who you saw, what time, and what you discussed. Start with that. And then once you get better, if you have more things you want to add.
Okay, I must have at least 20, 25 journals started. It's all over the place. I've tried everything, and
Well, just do one medical journal and just keep everything in there.
And then, like, months gone by, I haven't done anything, you know?
Just bullet points.
Yeah.
Yeah.
Just keep one
Until it
journal.
gets easier.
She can attest, I start one folder, and then I forget to have that folder,
Oh,
I start
yeah.
another folder, and I know what you're saying, but I just don't get mad at myself and anymore. I just realize, and I just destroy that folder.
Just
put it
find what
together.
works best for you. Yeah, this is just a suggestion. Yeah.
I can tell you, because I'm still with the lawyers, Bernstein, you're gonna regret it if you don't. I mean,
Yeah, I know,
like Deb
people
says,
told me that. Yeah.
Deb says, I
Especially
mean,
just
I didn't write it
litigation
because
is
I
wrong.
didn't really, I still denied anything was wrong 4 years after, right? And now I'm trying to go back and say, well, this is what I was doing at the time, and I really have nothing else, like nothing to base it on.
Yeah.
So,
And mine weren't anything fancy. I should bring it in to you and show you someday. It's just a ragtag booklet, a spiral bind booklet, like my call log there. And it's just, I just wrote little notes in there when I had an appointment, when I saw somebody, and what we did. And then sometimes after a while, I wrote down more stuff. But you just do what you can do. At least you have something written down there.
I thought it helpful if you just put the date on a piece of paper, and then you can, or somebody can help you consolidate them. Like if you've got notes on this piece of paper and notes on that, and you can just
Yeah.
tear them out of the booklet, and if they're dated, then you can just put them in chronological order. And
Yeah.
as you look at them, it makes more sense because you start getting better at it, and there's more detail. But at the beginning, it's just chicken scratch, and then
Yeah.
it's
Yeah, and I find too with the whiteboard I have on my, I take a photograph of that at the end of every month, and I keep a file of those. So if you can't write stuff down, at least document somehow what all your appointments were, or print off your calendar from your calendaring program, whatever it is
I
you're
got it
using.
good. Okay. I live with my daytimer, otherwise
Okay.
I don't go anywhere.
Yeah,
So that is good, like,
Okay.
that's all.
where I've
Yeah.
gone and come back from.
Yeah.
It's,
and maybe is there space in there you can write little notes on the side or something or other about anything?
Well, yeah.
So that might be a start. Yeah, just do what you can handle and you work from there.
Yeah.
Yeah.
Just record it. Listen, here it is.
Yeah, that would be way easier.
So now we move on to self-care. And I just slightly touch on this because we did cover this more in depth on one of our coping strategies videos, which I will refer you to here. Self-care is care provided for you by you. It's about identifying your own needs and taking steps to meet them. Taking the time to do activities that nurture you. Simple things like soaking in the tub for a while, going for a walk in the gardens, watching comedy movies, ordering in your favorite food, something that's simple and natural or nurturing for you, and just something that you enjoy doing that possibly you haven't done in a while. And you go, oh, I can't remember the last time I did this. I should do this more often. That type of thing. Can you think of anything right now that you could do to nurture yourself?
I like to have a bath,
Well, yeah.
but then I read, which is not the best.
I used to read in the tub, but not, well, I soaked for 30 to 40 minutes. That was my goal every day.
And I quilt.
Oh, yeah.
I
that's
try
right.
to. I'm
Mhm.
having trouble getting that back.
Yeah,
But see, all this stuff involves your eyes, right?
yeah,
And that's one of the stressors.
yeah. Yeah. And you're,
Getting that back.
how far along are you in your recovery?
I'm
just over a year in.
Yeah, yeah,
Yeah.
yeah,
But I'm having major problems with my eyes, so.
yeah, yeah. Well, you've seen Dr. Penny, so that's a good start.
Yeah.
Yeah. Okay. And taking proper care of yourself and treating yourself as kindly as you treat others. Women have a problem with this. I don't know why, because we're the natural born nurturers, I guess. We're good at taking care of others, but not ourselves. So this is probably a new thing a lot of us have to learn. And here are some examples of self-care: meeting friends for lunch, attending a class to learn something new, buy yourself a special gift, spa treatments, hair appointments, watching comedy movies, making room in your life for naps to rest and recharge. And like I said, we did a video on coping strategies part 1, and we do talk in depth about self-care on those videos. So managing your concussion recovery, avoid overstressing and overthinking. Recognize that this injury and healing process are going to take some time. You have done nothing wrong. You are doing the best you can under these circumstances. There is no magic pill to make this all go away. It takes time and it takes hard work, and the 3 Ps is what I call them: patience, persistence, and perseverance. Just never give up. You have to just be like a bulldog or a pug and just never give up. And learn to live in the now with what is happening, not what you think should be happening. Keep notes and records greatly helps to avoid overthinking, which is actually a hallmark of this injury. Stop overthinking. You can't control everything. So many people I've met with brain injury said they just can't shut their brains off. This is why the relaxation response technique and all that kind of stuff really comes into play. When and where to ask for help. Educate yourself and those around you about what a concussion really is. Understand that the healing process is unpredictable and uncertain, and that everyone is different in their progress with this injury. Having anxiety and experiencing depression are part of this injury. Highly suggest joining concussion support groups so you can understand you are not alone in this. If you really feel you cannot handle all this, then please speak to your family doctor about obtaining mental health services. And in the greatest of emergencies, please call the Distress Center here in Calgary. They have a 24-hour crisis line, and there is their phone number there, 403-266-HELP, HELP, or 4357. And I have utilized those. Additional points: it's okay to cry, be angry, and be sad. You are going through a difficult healing journey that very few truly understand. Do not compare yourself to others. Try not to be too hard on yourself. It's okay to ask for help. Learn to be patient. Learn to be kind to yourself. Learn to love yourself. The secret of change is to focus all of your energy not on fighting the old, but on building on the new. And now that's the end of that presentation. I go on to community resources. Everything technically seems to be okay. We're making great time here. I probably went a little bit faster because I was worried about the projector cutting out. So this is the CAR program that we had mentioned earlier, the Community Accessible Rehab. And it's a short-term active rehab program, and there are you need a referral from your family doctor, but only after 3 months post-injury. And their thinking on this program is that most concussion symptoms will clear up in that amount of time. But here all of us are sitting here, and it's been a lot longer than a few months. There are 3 centers where this program is offered: at the Pede or Lougheed Center, Sheldon Shamir, and the South Centre Health Center, and you have access there to neuropsychologists, occupational therapists, physiotherapists, psychologists, recreational therapists, social workers, speech language pathologists, and therapy assistants. And as Carol mentioned, they might be changing this program to be just sports related, so I do have to look into that, and I will try and have an answer for our next meeting in January. And there's also the Calgary Brain Injury Program, Department of Clinical Neurosciences at the Foothills. They have an outpatient service program there. And this is for people with moderate or severe acquired brain injuries. However, they do have acute concussion education program, which consists of symptom management, advice by phone to individuals affected by concussion within 3 months of injury. So you have to get to them, I guess, before the 3 months time frame. No assessment is provided, and you need a referral from your family doctor to get into that. There is changes going on in that program. I'm not aware yet of what everything that's happening, but just check with your family doctor and see if that's something he or she suggests would be a good option for you. As well, too, we mentioned holistic chiropractors or functional neurology chiropractors, and there's one here, Dr. James Haxton. He's in Calgary, and he was trained by the Carrick Institute down in the States. This designation is only held by 27 chiropractors in Canada. I think that's gone up now. It might be as high as 32. I did update on a slide, but obviously this came from another program that I didn't update it, so it is increasing. And he's down at Heritage Point Wellness, down in Heritage Point. Also, Vision Therapies, Dr. Margaret Penny, and she has her own private practice, Mayfair Eye Care, and she has worked with the traumatic brain injured for over 20 years. I believe it's almost even 30 years. And she offers vision therapy and full vision assessment. She puts you through a whole array of machines to double check everything physically with your eyeball to make sure physically everything is fine. You don't have glaucoma or anything, brain bleeds in your eyeball or anything like that. And that proves that it is vision issues related to concussion. And then she has vision therapy that she can offer with her associates, Laura and Lynn. And as well, too, we have local meeting groups here in Calgary. There's 3. We're the last one here at the bottom, Calgary Concussion Awareness and Support. The other 2 that started up here is Concussion Life, and they meet the first Monday each month in Kensington. There's a website for them. And the other one is Concussion Info and Support Group. They are a meetup group. I believe they still meet twice monthly at the downtown co-op market, and you can check out the meetup website there for more information on that group. And online support groups, there's a ton of them on there for concussion help. Pink Concussions is for females over 25. And actually there's quite a few Canadians. Somebody was just asking a question, so now they set up a separate group for Canadian women who are experiencing concussions. So you can just check out that Facebook group if you want to get in there, and you can check on there. So I'm heavily involved in that one now too. And we meet the last Friday of every month from September to May, but not December. So our next meeting will be Friday, January the 25th, and we'll be talking then about grieving and accepting the new you. I figured that might be a good topic to start out the new year with your new selves. And future speakers, I've been suggested by a few people to different guest speakers that would like to come in and talk to us, but like I mentioned earlier, I've been super busy with other things, so I haven't had a chance to sit down and actually get any work done in that area, but I will work on that. So our meeting next one is Friday, January 25th. We do have flyers back there if you'd like to help yourself and pick some of those up and post them around in your neighborhood bulletin boards at the co-ops. They do post them up there, but you need approval from the customer service counter first. If you prefer to receive a flyer electronically, add your name to the email list. And please also visit and like our Facebook page so you can keep up to date on meetings, pertinent articles, events, and general information. Does anybody have any comments or questions? Or we can head right to our open discussion and sharing circle, which we do not record, so I'll shut the camera off now.
And so that concludes our meeting for this evening. Thank you everyone for who attended. And our next meeting is Friday, January the 25th, and we'll be discussing grieving and accepting the new you. And this mostly applies to people who've been dealing with concussion and traumatic brain injuries that have lasted more than 2 years. We hope to see you there, and everybody have a Merry Christmas. We'll see you in January.